The next step is to place the catheter. Use fluoroscopy to identify the intraspinous intervals in the lower mid-lumbar region. A paramedian oblique needle insertion technique is recommended. Using fluoroscopy, insert the 15-gauge non-coring needle and stylet with the beveled needle tip oriented parallel to the longitudinal dural fibers. Advance the needle until the dura is penetrated. Check the position and placement of the needle under fluoroscopy. The imaging target for the needle tip is the midline of the selected interlaminar space. Partially remove the needle stylet to observe cerebrospinal fluid backflow and confirm the intrathecal location. Then replace the stylet to prevent CSF loss. Before introducing the catheter, make sure the guide wire is fully inserted, with its plastic hub seated against the proximal end of the catheter. Turn the needle bevel cephalad using fluoroscopy or the gauge marker on the needle hub. Remove the needle stylet and thread the distal tip of the catheter through the needle to the desired vertebral level. Expect a slight increase in pressure when the tip of the catheter reaches the curved point of the spinal needle. If you encounter any resistance in advancing the catheter, try to reposition the patient, rotate the needle slightly, or change the needle depth or angle. Do not pull back on the catheter with the spinal needle in place. Pulling the catheter back could lacerate or shear off the catheter in the intrathecal space. Confirm the position of the catheter tip with fluoroscopy. The centimeter markings on the catheter can also be used to determine the length of the catheter in the spinal canal. With the needle still in place to protect the catheter, make a linear or curved incision that exposes the lumbodorsal fascia. The incision should be long enough to permit placement of the catheter anchors without introducing kinks or sharp bends into the system. Carefully remove the needle from the fascia. Then grasp the catheter near the exit site and carefully slide the needle to the end of the distal catheter. While still holding the catheter close to the entry point, slowly withdraw the introducer needle and guide wire together. This prevents the needle tip from damaging the catheter during guide wire removal. After confirming CSF flow, thread the V-wing anchor onto the distal catheter segment and clamp the end of the catheter to the drape above the incision site to prevent CSF leakage. Confirm catheter patency for CSF flow after ligature placement.